Your blood sugar can drop dangerously low, and your body will not always warn you the way you would expect it to. I've had type 1 diabetes for 60 years. I know every signal this disease sends. And the people who end up in trouble are not the ones who experience the low, they're the ones who did not recognize it in time. This video covers all of those warning signs, exactly what to do when it happens, and the best 3 continuous glucose monitors you can buy right now without a prescription. So you never have to guess where your blood sugar is again.
What is hypoglycemia and why it happens on the DDS? Hypoglycemia means blood sugar that is dropped below 70 milligrams per deciliter. At that level, the brain, which runs almost entirely on glucose, begins to send urgent distress signals throughout the body. Below 54 milligrams per deciliter is considered severe hypoglycemia and requires immediate action. For people starting the Dominate diabetes system, hypoglycemia risk is real and specific. A whole food, plant-based, low-fat diet dramatically improves insulin sensitivity. That is the goal. But if you are still taking the same insulin dose or the same medication dose that was calibrated for your previous diet, the improved sensitivity means insulin is now working harder than it was before. Blood sugar can drop further and faster than your current dosing accounts for. If you are on insulin or any blood sugar-lowering medication and you are starting the DDS, talk to your physician about adjusting your doses before you begin. Do not wait until you experience a low.
The warning signs. Know every one of these. Your body gives you warning. The key is learning to recognize the signals before they escalate. Here are the signs of low blood sugar in the order they typically appear. Early warning signs. Blood sugar 70 milligrams per deciliter or below. Shakiness or trembling, especially in the hands. This is often the first physical sign and the easiest to dismiss as hunger or fatigue. Do not dismiss it. Sudden sweating, particularly cold or clammy sweat that comes on without physical exertion. This is your nervous system firing the alarm. Heart racing or pounding, a sudden increase in heart rate without a clear cause. Your body is releasing adrenaline to push stored glucose out of the liver. Hunger that feels urgent and sudden, not ordinary hunger, but a sharp, almost anxious need to eat immediately. Irritability or anxiety, a sudden mood shift, feeling on edge or upset without a clear reason. This is the brain reacting to reduced glucose supply. Pale skin, blood being redirected away from the surface as the body prioritizes core function. Moderate warning signs. Blood sugar continuing to drop. Dizziness or lightheadedness, feeling unsteady when standing or moving. Sit down immediately if this occurs. Headache, a dull or throbbing sensation that comes on quickly, often at the front or sides of the head. Blurred or double vision, the brain struggling to process visual input clearly under reduced glucose. Difficulty concentrating, thoughts that feel slow, foggy, or hard to hold on to. Simple tasks suddenly feel difficult. Weakness or fatigue, a sudden heaviness in the limbs, feeling like your strength has been cut off. Tingling or numbness around the lips or tongue, a neurological signal that glucose to the brain is critically low.
Severe warning signs. Immediate action required. Confusion or disorientation, not knowing where you are, what day it is, or what you are doing. At this stage, the brain is in serious distress. Seizure, involuntary muscle contractions caused by severe neurological disruption from glucose deprivation. Loss of consciousness, the most serious outcome. At this point, the person cannot treat themselves and requires emergency assistance immediately. If someone loses consciousness due to low blood sugar, call 911 immediately. Do not give food or liquid to an unconscious person. Emergency glucagon is the appropriate treatment and requires a prescription. Ask your physician about having it on hand. What to do when blood sugar goes low? The 15-15 rule. The moment you recognize early warning signs, especially if your meter confirms you are at or below 70 milligrams per deciliter, follow this protocol immediately. It is called the 15-15 rule, and it is the standard response used by diabetes educators worldwide. Step 1. Consume 15 grams of fast-acting carbohydrate immediately. Not a meal, not a snack. A fast glucose source that the body can absorb quickly. The best options: 4 ounces of fruit juice, apple or orange, no added sugar, or 4 glucose tablets, available at any pharmacy without a prescription, or a tablespoon of honey, or 4 to 6 ounces of regular soda, not diet. Step 2. Wait 15 minutes. Then check your blood sugar again. If it is still below 70 milligrams per deciliter, repeat step 1. Do not eat a large meal to treat a low. You will overshoot and send blood sugar spiking in the opposite direction. Once blood sugar has recovered to above 80 milligrams per deciliter and you feel stable, eat a small whole food snack, a banana, a small bowl of oatmeal, to prevent a secondary drop. Then identify what caused the low and adjust your system accordingly. Carry fast-acting carbohydrate with you at all times during the early stages of the DDS. Glucose tablets in your pocket, juice in your bag. This is not optional. It is the insurance policy that lets you run the system confidently. A continuous glucose monitor, a CGM, is the single best tool for catching low blood sugar before it becomes an emergency. It measures your glucose every few minutes and sends the reading to your phone in real time. No finger sticks, no guessing, just a continuous picture of exactly where your blood sugar is and which direction it is moving. Until 2024, every CGM required a prescription. That has changed. Here are the 3 best over-the-counter options available right now. No doctor visit required. CGM number 1, Dexcom Stelo. Best overall OTC. Most accurate. The Stelo is built on the exact same sensor technology as the Dexcom G7, a consensus gold standard among clinical CGMs. It was the first CGM ever cleared by the FDA for over-the-counter sale in March 2024, and it remains the most accurate OTC option available. The sensor wears on the back of the upper arm for 15 days. The Stelo app shows your glucose trend in real time, where your number is, which direction it is moving, and how your food and activity are affecting it throughout the day. It does not include alarm functions for highs or lows. That was excluded from the OTC clearance, but it gives you the data to see a drop coming well before it becomes a problem. Cost: $99 for a 2-pack, approximately $49.95 per 15-day sensor. Available at major pharmacies and online without a prescription. Best for anyone starting the DDS who wants clinical-grade accuracy and the most trusted sensor technology available. The data-forward approach rewards people who want to understand their patterns deeply. CGM number 2. Abbott Libre Rio. Best for Type 2 coaching plus insights. The Libre Rio is built on Abbott's Freestyle Libre platform, the best-selling CGM technology in the world with over 6 million users globally. It is FDA cleared specifically for adults with type 2 diabetes who manage their condition through diet and activity rather than insulin, making it one of the most directly relevant OTC tools for DDS members. The sensor wears for 15 days and measures glucose across a range of 40 to 400 milligrams per deciliter, the widest measurement range of any OTC CGM. The app provides personalized glucose insights, in-app coaching, and Apple Health integration. The coaching layer makes it particularly valuable for people who are newer to CGM data and want guidance on what the numbers mean. Cost. Expected to be competitive with Stelo at approximately $89 to $99 per month for 2 sensors. Check Abbott's website for current availability and pricing in your area. Best for Type 2 DDS members who want a coaching-forward experience built on the most widely used CGM technology in the world. CGM number 3, Abbott Lingo. Best for wellness tracking, budget entry point. Abbott Lingo is positioned as a metabolic wellness device rather than a clinical diabetes tool. It is built on the same Freestyle Libre hardware as the Libre Rio, but cleared for general wellness use, meaning it is appropriate for people without a formal diabetes diagnosis who want to understand how their food, movement, and sleep affect their glucose in real time. For DDS members who are pre-diabetic or who want to monitor their metabolic response without a diabetes diagnosis, Lingo provides an accessible and affordable entry point into continuous glucose monitoring. The app includes lifestyle tips, including suggestions to take a short walk when glucose starts rising, which aligns directly with the DDS movement protocol. Cost $49 for a single 14-day sensor or $89 for a 2-sensor 4-week supply, the most affordable entry point of the 3 options. Best for DDS members who are pre-diabetic, metabolically curious, or who want to try CGM at the lowest cost before committing to a longer-term plan.
Well, know the signs. Carry glucose tablets, talk to your doctor before you start if you're on medication. And get one of those CGMs. Seeing your numbers in real time is not a luxury. It's really the difference between reacting and knowing. Do this right, and the Dominate Diabetes system works. Your blood sugar will respond, and now you will be ready when it does. That's not managing it, that's dominating it.